Hi class, my name is Logan Reed, and I'm doing case 8.2, which is moral conflict in clinical trials. And so first I just kind of want to describe what my case was about and just so you guys have the background of what's going on in the case. So it starts off with Dr. O'Caro, I think that's how you say his name, and he's an investigator and he's conducting a phase 1 of a clinical trial for a new chemo drug for cancer. And so he has a subject, and it just talks about one subject. There are several different people within the trial. But she's a 49-year-old female, and she has metastatic breast cancer. And so her 3 diagnosis sites include her liver, lung, and then axilla region, which is just like under your armpit. And the one that is the worst lesion is her liver, which is unfortunate because your liver is crucial to survival. I'm not sure what all you all know about the liver, but your liver is what detoxifies chemicals and metabolizes different drugs. So, there's bile production, and that helps carry out waste. And then when liver has broken down those harmful substances, they're excreted into either bile or blood. And the bile products go to the intestines and then leave through the feces, whereas blood filters out, the blood byproducts are filtered out by the kidneys and then through the urine. So that's just kind of a little bit of background of just what the liver is and how important it is for the body. And the fact that she has a lesion site at the liver just kind of shows just kind of like that medical background of it's very crucial to survival to have your a functioning liver. Anyways, so Dr. O'Caro, he's the one who's the investigator, but he's also conducting the phase 1. And that's important. We'll talk about that and the ethical part of that later. But each subject is received experimental drug by intravenous infusion for 6 21-day cycles. So it's pretty intense treatment, but it also, it breaks it up within those 6 21-day trials. And the science behind it is to test the cumulative toxicity, and they're testing the irreversible effects, which seems off, it just seems different, but that's obviously the part of the clinical trial. And that's when they may show up in later cycles of like loss of sensation in your hands or your feet, and it's just those irreversible effects, whereas in normal chemotherapy, it's usually the reversible effects for 6 different cycles. Anyways, so Miss Hernandez received 4 cycles of the drug, and it noticed that she wasn't sick, and she wasn't noticing any of those irreversible effects. And at this point, other subjects had already been withdrawn from the clinical trial because they either were presenting with effects that were just too severe to not continue on, or they withdraw because they didn't want to risk getting worse, or just anything like that. I mean, it doesn't really necessarily say in here, but that's just kind of recognizing that it's their choice. But for Miss Hernandez, her liver and lung lesion remained stable, which was a new experience. So that was, if anything, it's a plus for her. But her axillary, which is under her arm, has grown and increased 22%. And so that's kind of a lot, especially for a lesion in that area. And the reason that kind of causes some issues is because that indicates a likelihood of growth for 2 of the other sites in the future. And so that causes a problem because with more liver damage, that could definitely be very harmful for Miss Hernandez. But Dr. O'Caro, in the case study, it says that he talks about all of the different characteristics and looked at her, where she's at her stage, and had that conversation. And of course, she has the ability to say no. And at the end of this case study, she had not said no. She had talked with her physician. They've gone over all of the what ifs and all of this. And so that's what it ended as, is just, depending on what she says or what she decides ultimately, where is that line? And so just a few of the moral issues that I would like to bring up today is just whether or not Dr. O'Caro should step in to withdraw Ms. Hernandez for her health, since she has had a 22% increase in that lesion, which could be detrimental to her health, very much impactful. Or another issue is whether it's ethical to continue on with treatment just in general because she has had that increase, 22% increase. And then another moral issue is, just at what point should the patient withdraw, and whether patient safety at the time being should be compromised for clinical trial data. And then just lastly, the conflict of interest with Dr. O'Carroll with the research and as well as the health. He was the investigator as well as the individual completing the phase 1 of the clinical trial. And so just a few things that I wanted to point out. One of the questions after my case study, it says, taking a utilitarian stance, what would be the outcome for Dr. O'Carroll's decision? And then likewise, a Kantian stance. And so we went over utilitarianism pretty early in the semester, and that's just the ethical theory that states that the best action is the one that maximizes or benefits the majority. And so producing the greatest well-being for the greatest number of people, or increasing happiness, or increasing just general good for all, but decreasing bad, which could include pain, could include happiness, and anything that's going to benefit everyone is the way to go. So in this case, this is when, through the stance, they would follow through with a trial to get results to benefit all future patients. Because if Ms. Hernandez was going to quit the trial, that would also quit the data in the trial, and so that would cause some issues. Whereas if she continued on, this could potentially help further patients who have cancer or any kind of things that they need this chemo drug, obviously with cancer. And so that's just the utilitarianism stance, whereas the other stance believes that moral rules are universal, and it's right to do actions purely out of respect for morals, and so really the goodwill to do right things. So in this case, they probably would not follow through because it's affecting a person's health individually, even though it could potentially bring a large group to be benefited. It's not necessarily benefiting this one person, so it's technically immoral to put them through the rest of these trials and impact their health and potentially put their life at risk. And so it's interesting to me to look at those two stances and to just kind of analyze like what they would do or how they would do it because of what they believe. But personally, as I was thinking through this, at first, I was just I didn't really know what to think. But now that I've gone through it and I've kind of looked at just the pros and the cons of continuing on with treatment or not continuing on with treatment, I recognize that ultimately I side with it's up to the patient. And I come from a medical background. I'm actually in school for occupational therapy. And so I've definitely gone over just patient consent a lot. You have to get consent. You have to get consent, even with therapy. Performing therapy. And that's minute compared to doing clinical research that is affecting health very intensely. But I think it is ultimately up to the patient. So in this case, I think it would be up to Ms. Hernandez. I recognize that there could be a conflict of interest just because Dr. O'Carroll is the investigator as well as conducting the research. But I think that as long as he has communicated, okay, this is what is going on, and these are the recent changes in your medical status, and I want you to be aware of them. I want you to know that this is what is going on, and as long as he gives her all of the information that she needs to go talk to her physician, then I don't necessarily think that is a conflict of interest, because I think it would be a conflict of interest if he didn't give her those updated medical status and, hey, here's what's going on, here's what could happen, you need to be aware of these. So I think that he should be able to, as long as he gives the information, then it is fine. But I just have a few questions. So the first one is, should Ms. Hernandez potentially risk her life for the unknown and for clinical data? At what point do you think Ms. Hernandez should withdraw? Do you think Dr. O'Carroll has a say in the timing of her withdrawal? And do you think clinical trials are always ethical with patient consent? And so you guys kind of saw my background. Just as long as there's patient consent, then following along with treatment is fine, because ultimately it's their decision. And that just seems to be what is ethical in my mind. So yeah, thank you for listening, and I hope you guys enjoyed this. And I also hope you've enjoyed this class. It's definitely been eye-opening for me, and we only have 2 weeks left, so I hope you guys have enjoyed it. So thank you.